Hello, I'm Dr. Ruth Roberts, and I will apologize in advance for any banging you may hear in the background. Got a fella here doing some work on the house we're staying in. So we had a bunch of great questions for this week, and so I'll just kind of take it from the top. Lolly had posted a link about leaky gut in dogs and why you shouldn't feed your dog coconut oil. And I have to say that I can't agree with that as a blanket statement. Again, you have to look at your individual dog. Some of the points this fellow brought up were great, but is he a vet? Does he have a lot of experience with dogs? It doesn't appear so. So that's a little frustrating, and I think what you want to do is take everything with a grain of salt that you read, because there are a lot of folks out there, purporting to be experts on things. I don't know this fellow well, and his topic was in this episode, supporting the vaginal microbiome, the root cause of acne. So they were sort of ranging over a bunch of topics. And I think it's good information, but it doesn't necessarily always apply. So if it makes sense for you and your dog, and Lolly, I think your pups have had pancreatitis, so it makes sense to not feed coconut oil all the time, then that's reasonable. Now, I will say that I think coconut oil is a good oil, and there is good nutrients available in it. But I do think that you should rotate. But at any rate, see if it makes sense to you. Don't take everything as a blanket statement. That's how we got into the situation of keto's the best diet. No, being vegan is the best diet. No, being paleo is the best diet. No. See what I'm saying? So it doesn't. One statement doesn't cover everybody. Same thing with dogs. Another client sent me a post from Dogs Naturally where this woman was completely dismissing fish oil. And she brought up some valid points. If you're not careful about where you buy your fish oil, it can be contaminated with heavy metals, it can be oxidized, all of these things. Those are all true if you buy cheap fish oil. But if you get good quality stuff, so Prothera's, Icosamax, which I've private labeled as the Crock-Pot fish oil, or Nordic Naturals, or Carlson's, those are all high quality companies. And so this idea of not using fish oil and using krill oil instead, or I think she was suggesting phytoplankton, doesn't work very well, because once krill oil became a thing, the krill mass off the coast of Greenland was decreased by 30%. Same thing with phytoplankton. These guys are at the very bottom of the ocean food chain. And so if we start hacking away there, we are going to be in deep trouble, because if we diminish those populations sufficiently, then that means that nobody else gets fed. Does that make sense? So think your way through things. Don't take anybody, including what I say, as gospel truth, because it often is not. Now, Anya sent a picture of a supplement that purports to help improve neurotransmitter production and be calming. The thing in there that is calming is tryptophan. And Anya, I don't know that you can get this product in France, but I'm going to give you an example of something I've used in the past that works really well, and that's liquid NutriCalm. And it's a tryptophan theanine product. I think it also includes a small amount of valerian root, but it has been a godsend for many pet owners. Now, secondly, she asked, her dog needs to lose some weight, and last week she reduced the amount being fed and all of that good stuff. And I apologize. So somebody's saying that Lolly, she asked Lolly to post because she was unable. The guy is a great microbiologist, and that's great. But sometimes folks step outside of kind of what their knowledge base is. But, again, don't take anything as gospel truth. So anyway, back to Anya's other question. My dog needs to lose some weight. And so she was starting to go through this really complex set of calculations. And what I would suggest doing, Anya, is just if there's quite a bit of weight that needs to be lost, I would reduce the amount being fed by about 25%. So if you're using a cup, and I can't remember the European equivalences in measuring cups, but just cut back the volume by 25%. Once she has lost the weight that you feel she needs to lose, then increase the volume by, say, 10% and hold it there for 2 weeks. If everything is, staying steady, looking the way she ought to, great. If she's still losing a little weight, then bump it up to, say, 15%, until you kind of hit that sweet spot, if you will. I hope that makes sense. Let's see. And then Bettina is asking about Murphy, who for the first time in over 2 years did not eat much breakfast. He's spitting up some yellow foam, some white foam, and it happens when he jumps off the couch or if he's overexcited. And he is an anxious kind of guy, and so she's been working through some food changes. And what I'd like to suggest is that there may be some food issues present, but there may also be a physical issue present. So if you know that that he's an anxious guy, and that this is happening when he's like super excited or he has jumped off the sofa, then to me that sounds more like a physiologic issue. So what I would do is start looking at, is there something that's changed in the house that would make him more anxious? Like holidays are starting to happen, people are coming home, and we're getting into all this frenetic stuff about getting Thanksgiving dinner cooked and decorations and yada, yada, yada. That may or may not be happening there, but those are the things I would start to look at. If there's not a big change going on, then I would really kind of consider getting some basic stuff done at the vet's office, getting an exam done, make sure that there's not something going on internally that's, and the worst fear is always cancer, of course, which you've gotten through with Mary, thankfully. And then x-rays of the abdomen, things of that nature, to make sure there's not a physical cause for this. What is so frustrating for many pet owners, and what's been frustrating for me, is they'll, go through all these very elaborate food changes and things of that nature, only to find out that there really is a physical reason for some of the issues they're seeing. So again, check it out with your vet. Start there. Make sure there is not a physical reason, like Mona, who had a bone stuck in her belly, something that's creating a problem. It doesn't always have to be cancer. It can be some stupid dog thing, that the dog has outsmarted us yet again and gotten away with it. So I hope that's helpful, Bettina. And I'd keep working on the rotation of and eliminating foods, but just make sure that there's not more anxiety, more energy in your house, and then B, that there's not a physical recommendation. So Deb is asking about the recommended dosage of quercetin for a 20-pound dog with kidney disease. And Deb, you'll want to give somewhere around 200 milligrams twice a day. So that's about a half of a capsule of the Now product that we've been using for years. And again, if you're a member of iPets Ally, and I hope you guys took me up on that special offer of 3 months free, if you're a member of iPets Ally, all of the doses for these supplements are in, let me make sure I'm getting the right one in there for you. I think so. Yep. All of the doses are in the one of the sections within iPets Ally. So go check that out if you haven't. That way you can really, answer a lot of questions for yourself. So I hope that makes some sense. And there it is, the quercetin and bromelain caps. So these are typically 400 milligrams a piece. The bromelain is in there to help aid with absorption of everything. So let's see, and then Karen's asking some questions about raw bones. And I think you got a lot of great answers, Karen. What I would suggest doing is just start slow. So get large bones if they're super hardcore chewers, and have them be again, the raw prevents them from splintering as much. Having said that, there are dogs that will annihilate an entire tibia in 3 hours, and that's not a good idea. Start slow, start with 3 to 5 minutes at a whack. Make sure that your dogs are good at giving up this super big treasure. So I would suggest Thanks. I'm looking at Anya's response, so I think I can fix that for you. So I think we can what you can do is make sure they will give you the treat, and in exchange for another small treat you've got in your hand. Does that make sense? So you want to be able to do a trade. And Anya, thank you for clarifying what your problem is with joining iPets Allies. So I think I can get that fixed in Infusionsoft. So Karen, I hope that is helpful. But yeah, I think it's a great thing. If they're like annihilating a quarter of a bone in 5 minutes, I would definitely continue to make this a 3 to 5 minute a day thing, because what you don't want them to do is just chow down on the bone and then they've got a bunch of bone shards. Additionally, if they're chewing really hard and chunks are breaking off, then not so good. Another thing you could consider would be something like deer antlers, and they tend to be much more difficult to chew on. You also want to make sure if they're chewing like mad, that they're not hurting their teeth. So we have seen some dogs actually fracture teeth, which kind of stinks, and that's kind of beside the point. Lee and Kathy are actually both asking somewhat similar about the same thing, about chicken being a potential allergen. And it is one of the most common allergens because it's one of the most commonly fed proteins. So Lee's asking about the chicken flavoring in Arthur E's Gold, which is a joint supplement I've used forever. And what I would suggest doing is looking at a shellfish-based supplement. So one of the ones I've come across is Arthur Soothe. That's worked really well for Mona. So check that out. And take that out and see if that doesn't help quite a bit. Another option is, and where the chicken typically is in these joint supplements, is in the glucosamine and chondroitin sulfate, and that's the point of going to a shellfish-based ones. So I hope that's helpful. And then Kathy, if you think you're seeing more scratching, then I would definitely pull the chicken and use a different protein if possible. And I know for you that may be difficult because of just availability in Morocco. So, look for things like goat probably would be a protein you could get pretty easily there. So that's another one you could try. And she's also asking about a tick that may be lodged in one of her pup's sides. And what I would suggest is just pull the tick. We got told when we were kids that you have to get the head out. You really don't. And what I end up seeing is people that end up creating a big trauma to the dog or the cat trying to get the head of the tick out. So if you've pulled the body off, things are good to go, the tick is dead, all is well. You want to do that as soon as possible for a couple of reasons. One is so it doesn't get the opportunity to create more irritation, and the second is so that there is less time to transmit all the tick-borne diseases like Lyme disease, Rocky Mountain spotted fever, Ehrlichia, things of that nature. And so Kathy, I'm not sure if those are issues where you are in Morocco or not. If they are, what's often suggested is to do sort of a morning after dose, if you will, of doxycycline. And if the tick had been implanted for more than anywhere from 24 to 72 hours, depending on which tick-borne disease is present in your area, then it is recommended to give actually a full dose of doxycycline to prevent the disease. I don't know of a natural product to give post-exposure to prevent tick-borne disease that's been super effective. Will Falconer, who a dear friend and colleague of mine, has been able to use homeopathy fairly effectively, but I am not skilled enough with it in my hands. So that's what I can tell you there. And let's see, what else do we have here? Kay is asking about beef trachea, and she'd previously been able to buy it from a local butcher to dehydrate it, but yeah, the government's kind of in everything, but it's, you know, unfortunately, salmonella is an enormous issue. So I don't know what to tell you about where to get good raw trachea from, but you can certainly, you know, if you're after that for the collagen portion, there's other options out there, including things like a bone broth if your pet's not sensitive to chicken, because again, you're getting that glucosamine and chondroitin out of there. A lot of the big marrow bones have the joint material, the cartilage still on the bone. That's a great source of cartilage. If you're looking simply for a chew, raw bones are great, things of that nature. So I hope that's helpful. Carol's asking about if she makes a huge batch in a 22-quart roaster oven, how many cups would that batch make? So essentially you can make 3 batches of food. That's about 18 quarts of food, and that, if you're using starches, will yield about 48 cups. If you're not using starches, it's about 12 cups per batch, so that's 36 cups altogether. And Kay is asking about fresh herbs to use. I would go really, really slow with that, because it can be off-putting to pets if they're not accustomed to these herbs. The fresh ones are more pungent than the dried ones, obviously. So I would start with a 1/4 teaspoon of 1 to 2 herbs per batch. And, you know, there really aren't any that are toxic or anything of that nature, save catnip for oils for cat, you know, so that's not a big deal if they're eating the dried herb there. But just be cognizant. Most of the herbs that you mentioned, the ones that are considered to be more Mediterranean, are really pungent. So the sage, the thyme, the oregano, the rosemary. So go slow with those, and they are warming. Parsley tends to be cooling and draining, and then chives seem to be a little bit warming as well. So just kind of and those are great for winter. Just be cognizant of what you're adding in there. And that's kind of all the questions I see. Let me go through the comments here and see if there's anything I missed. And I don't, oh, the Nutricalm, is that the best tryptophan supplement? And in my hands, that worked really, really, really well. I think it helps to combine a couple of things to make it, you know, easier for your pet to get calmed down. So again, the valerian root at a low dose, and then theanine is another amino acid that tends to have brain effects. And I think that one's a great one to start with. Plain tryptophan can be used as well. And Lidkey had a tryptophan chew that I haven't used, but it looked like a good one too. And Anya, yes, I did answer kind of all the questions already, so that'll be in the replay, which will be up as soon as we finish up here. Yeah, so you, in like 5 minutes or 10 minutes, Facebook will finish processing the video and pop that up there. Now, I would need to ask your help about consults. So, you know, I've had a lot of people saying, well, can Dr. Ruth just answer this? really quick for me by email. And ladies and gentlemen, if I did that, I would never get out of my email box. And frankly, this is kind of how I, make some money. And if I don't make money, then I can't keep offering you this information. And so that's part of why we went forward with iPets Ally and things of that nature. But what I need is kind of helping to refine what options would work for you in consultation. So the way it currently works is I've got two packages. One is the Optimal Health package, and then the second is the Advanced Care. And the difference is the amount of time that's available in it. So with the Optimal Health, I have a 30-minute phone call with you, but I'm taking 30 minutes to review your records that you've sent over, the pictures, the lab tests, all of that stuff, the intake form, which is quite lengthy, that you filled out, and develop an understanding of what's going on, and then a set of questions I can ask to get further clarification, and then start to note some possible suggestions for that particular animal. Then we have the 30-minute call, or in case of the Advanced Care package, that first call is 45 minutes. And then I make a recording of the call available, and then I'll send an email summary of the action steps, plus links to products we discussed and things of that nature, and then, if needed, specific recipes for your pet situation. So it may take me another 30 to 45 minutes to write that email. And then in 2 weeks, and then you email me back, let me know, is this, if it's clear or not clear, any questions we forgot to or didn't quite get to, that kind of stuff. And then, so there we are, good to go. And then 2 weeks, I'll send a follow-up email, and if there are questions that you've got, then we need to clarify or adjust, and then go from there. So that time period, even though we're spending 30 minutes on the phone, there's another hour and a half of work in there for me, right? So, and then with the Advanced Care, then we do another call 2 weeks after, so a month after the first one, and then that same thing of the action plan, call recording, and then follow-up email in 2 weeks. So right now, as far as follow-up, I know we've got a couple of options. Well, actually, I've got one option, and that is this. Let me add this in there. So basically, it's adding on another 30-minute call. It's at a lower cost than the initial one because I don't have to do quite as much work as far as understanding where things are. I'll review additional records, and then we'll have another 30-minute call. Action plan, it's very similar to the first setup. I know that's expensive, but it's a lot of time, and I think it is good value. And I think many of you can attest to the value that you've gotten. So I'm considering a couple of other options. So Denise had suggested, or had told me, that there are other veterinarians that charge $3 a minute. And so if I were to make that an option, I would start for new consultation clients. I'd start with a 30-minute review of the records. We'd have that 30-minute conversation on the phone or via Zoom, and then you could get a recording of that call, but sort of no email follow-up. And then after that initial call, then we do 15-minute increments. So essentially what I'm doing is, now you need to take notes through the call, and and then additional contact kind of takes more money, so to speak. And one of the other suggestions I'd gotten from a consult client was to do follow-up emails. So that would again be review of records and previous notes, and then respond to your questions with the answers I've got, clarify any questions that you may have on an email back to me. And so that, I think, would take probably 30 to 40 minutes of time. And that's kind of it just depends. So in many cases, I can answer things fairly quickly if it's a quick question and not like, oh my gosh, we've had this major thing happen that's going to kind of change the whole course of what we were discussing. So if I'm able to do a quick follow-up email, then that's going to take me 15, 20 minutes to type out the email, 15 minutes to review the records and additional labs. And so I would charge somewhere around 45 or 50 bucks per email there. So you all have a great deal of experience with what I have to offer, and I'd love to hear your thoughts on those three options. That, as I mentioned earlier, we've got you know, for Black Friday, Cyber Monday through Giving Tuesday, some really great options available and some bonuses on the advanced care package. So 3 months of iPets Ally, free holistic total body support, which, and then same thing with Optimal Health. And additionally, because you are the loyal crew, you get a very special discount code that will give you 10% off across the board, including the already discounted stuff. Because I like to thank the folks that have supported me, and I'm just trying to figure out how to make this work so that I stay supported, so that I can continue to pay the folks that help me and actually maybe make a dime. So many of you don't know this, but I've spent, I think July was the first month that I was able to take home any money out of this business since 2015. So that was really, really awesome. But you know, that needs to keep happening. So help me help you further by letting me know what makes sense for you. And the other thing I wanted to throw in here was the one library at a time, and I sort of talked a bit more about that in the main page broadcast, but on Giving Tuesday, they will be my charity of focus, and I'll give them 5% of our total sales. But this is a great organization. You know, it's something that helps to foster understanding and of different cultures and things of that nature. So check that out. Great looking. Oh, thanks, Anya, for booking that. I appreciate that. Thanks for your attention. Thanks for your great questions. And thanks, I think, Kathy, for putting that fellow's information up. I'll go check him out in more detail as well. So I'm sure he is an expert in his field, but just, again, you know, Dave Asbury thinks he's an expert on dog care because he's an expert on certain parts of avoiding mold and treating yourself for mold. So sometimes that works out and sometimes not so much. So until next week, have a happy Thanksgiving. Enjoy that with all your pets, with your family, and I'll see you next week with answers to more of your questions. Until then, remember, your pet's best health starts in the bowl. Thanks.